Hello, good afternoon. Hi, good afternoon. Hope you can hear us. Apologies for starting a little bit late. We were slightly double booked on our Zoom, so we apologize for that. Great, thank you. Thanks, Dan, for letting us know. So we're so sorry. We'll go ahead and get started. Give me 1 second and I'll pull up our slide deck for you.
While Christina is pulling up the slides, we just want to welcome you. Thank you so much for being here for today's question and answer session related to the California funding opportunity. Get those questions ready. We're going to give you a little bit of context. We're going to review some questions that we answered previously. And then we will jump right into answering yours. I will be taking some notes, and so all questions and answers will be posted to the website after today's session concludes. Christina?
Thanks so much, Amy. Hi, Christina Negrelli. So nice to see some of you returning from our informational webinars, and we're excited about your interest. And so we are just gonna, go over the funding opportunity a little bit more. It's probably a review for most of you. Talk a little bit about the application components, and then open it up for questions and review the next steps and important dates that are on the horizon. So once again, the HealthySteps National Office at 0 to 3 is soliciting proposals from pediatric and family medicine practices across Los Angeles County interested in implementing the evidence-based HealthySteps model. Through the generosity of the Conrad N. Hilton Foundation, the National Office will grant awards to fund at least 6 new sites and the associated costs of implementing the HealthySteps model. For example, training costs and HealthySteps specialist salaries for a limited time. This new funding opportunity may be able to accommodate more than 6 sites if applicants have existing staff on site or funding to help support the hiring of new staff who can be trained as HealthySteps specialists. It is anticipated that the HealthySteps National Office will grant awards to onboard, as I shared, a minimum of 6 new sites in Los Angeles County. And again, the total number of awards really are contingent upon a number of factors, including the number of eligible RFP responses received and the level of funding that is requested by each of the practices. The funding allocation has been designed with the baseline assumption of 6 sites needing everything for staffing, at least 1 HealthySteps specialist, which includes the HealthySteps specialist salary and fringe benefits, printing, copying expenses, a laptop perhaps, and other technological items, and possible local travel between sites if applicable. It also includes the cost for onboarding, such as training and technical assistance that is provided by the HealthySteps National Office. And our goal, as I've shared, is to be able to onboard more than 6 sites. So to maximize this opportunity and really stretch the funding as far as possible, we encourage applicants to assess their current staffing and identify what exactly they will need to become a HealthySteps site. It's possible that applicants may have, for example, a licensed behavioral health professional already employed that can be trained to serve as a HealthySteps specialist. Staffing considerations for applicants include the total number of existing licensed behavioral health professionals that can independently bill for their services, and will be trained as HealthySteps specialists, as well as details on how existing licensed behavioral health professionals are funded. If applicable, the total number of licensed behavioral health professionals to be hired with existing allocated funding, perhaps from a grant or other funding source, that can independently bill for their services and will be trained as HealthySteps specialists, and how they will be funded. And then lastly, if applicable, the total number of licensed behavioral health professionals to be hired that can independently bill for their services and will be trained as HealthySteps specialists, an amount of funding requested for the position. So these details are included in the request for proposal details. And also we've had a couple questions related to the level of funding that we've responded to and posted as a frequently asked question document up on our funding webpage. And I'll invite my colleague Amy to put the funding website link in the chat box for ease of access. So all eligible applicants need to be able to deliver or have the potential to deliver well child visits in the pediatric or family medicine setting, be a practice that is applying to become a new HealthySteps site, and have at least one existing licensed behavioral health professional on staff. And this is related to the staffing that we just shared with you. Or existing funding to hire a licensed behavioral health professional to serve as a HealthySteps specialist and independently bill Medi-Cal and or private insurances for their services, or commit to hiring a licensed behavioral health professional that can serve as a HealthySteps specialist and independently bill Medi-Cal or private insurers for their services, leveraging full or partial funds received through this RFP to cover the HealthySteps specialist salary and benefits for a limited time. My apologies. Thank you for letting me know about the annoying meeting reminder on the screen. And also eligible applicants must establish an implementation team with the required members as specified in the HealthySteps Exploration Guide, and commit to providing the HealthySteps specialists with suitable dedicated office space, which is seamlessly integrated into the practice within the medical office suite, and commit to meeting model fidelity requirements as outlined in the HealthySteps Fidelity Requirements Overview. And then once the network affiliate agreement is signed, so once the sites have been identified, then sites will receive the full set of fidelity metrics. And so some of the key dates, we released the request for proposal on January 5th. Today is our optional Q&A session for interested sites. As we continue to receive questions, we do update our FAQ documents and will continue to post them on our website. The site interest form and letter of intent is due on January 25th, by 5 p.m. Pacific Standard Time, with the request for proposal submissions due on February 4th. So once you submit, interested applicants submit the site interest form and letter of intent, you will automatically receive a link to go ahead and upload the request for proposal submissions. We will be evaluating the request for proposal submissions between February 7th and 11th, with the intention to notify selected recipients on February 15th. We hope that recipients will take a look at the notification and get back to us no later than February 22nd with their acknowledgement of the acceptance award. And with the anticipated training dates of spring of 2022 and fall of 2022. So with the intention there is to do two onboarding and training opportunities. So with half the number of new sites coming on board beginning in the springtime, and the other half of the new sites coming on board in the fall. And that's really to provide an opportunity for our training and technical assistance team, as well as other national HealthySteps National Office team members, to have the capacity to support the sites. And also because there's a lot of factors that contribute to the onboarding process and timeline. And so this will allow everyone ample opportunity to do what we need to do to successfully onboard sites and for sites to be onboarded. So again, please stay connected on our website. My colleague Amy has put the link to the website in the chat box. We did have a request for, we posted it as our response was to post a PDF review copy of the site interest form so that you can look at all of it in advance of logging into the system and completing the form online. We recognize that the system requires you to respond to each item before advancing forward. So this way you're able to review all of the components in advance. And we've also provided PDF review copies of all of the other things you will respond to as part of the request for proposal applications. And those are all available on the funding website. So we're just really excited, and our overall goal for HealthySteps is to reach 1 million children and families per year by 2032. So we really hope that you will consider becoming a HealthySteps site in Los Angeles and help us to reach this goal. So Amy, anything you'd like to add that I might have missed before we dive in and take a look at the questions?
No, Christina, you did such a nice job of the overview, and we've already got a lot of questions coming in through the chat and the Q&A. So let's kind of jump right in. I do want to add that Christina and I both are in California, and so just really excited about supporting this project, as well as supporting all of you as applicants. So our first question, Christina, if that's okay, is regarding the ratio of HealthySteps specialists to children receiving Tier 1 services. This is on page 2 of the exploration guide. Would an applicant be expected to have more than one HealthySteps specialist if it served more than 2,000 children ages 0 to 3 annually? Or could the applicant pilot the program and scale later as needed?
That's a great question, and Amy is also one of our HealthySteps training and technical assistance specialists, so I invite you, Amy, to jump in as well. So this is our guide and what we have provided as a recommended caseload, if you will, the capacity for one full-time equivalent HealthySteps specialist. So we want to ensure that we give some guidance so that the expectations are, you know, in alignment with what we believe the capacity of the HealthySteps specialists would be able to meet. So I don't know, Amy, if you have anything else to offer there.
No, I think that's a very good answer. Absolutely. So our question 2, and again, if there are follow-up questions to any of these, please put those in the Q&A. On the list of letter of intent components, this is the LOI, on page 7, the RFP questions 3 and 7 are identical. Do applicants need to address this question twice? So Christina, I looked ahead and I found out what questions 3 and 7 are, and they are about the kind of the name of the sites. I would say the way the questions are worded, go ahead and address the question in question 3 And question 7, I also don't think you can proceed without doing both of them. So for some of our sites, there are organizations and there are specific other kind of sites that flow down from that. So it may be the same answer, or you may have like a South clinic and a North clinic that you want to name there. Christina, did I answer that?
I believe so. Thanks, Amy.
Awesome. And I want to apologize that my camera isn't on. I have tried to turn it on and I don't know what's happening. So I apologize that you are just getting my voice this morning or this afternoon. So question 3, can you provide more details regarding allowable expenses beyond the HealthySteps specialist salaries and training costs? Christina, can you address this one?
Yes, and I think that we covered that a little bit in the beginning. So the goal is really to be able to think of what the needs are of the HealthySteps specialist in order to be successful. Some of the examples that I provided might be that this is a new position, for example, and a HealthySteps specialist may need to have their own laptop, for example, or we know that in another example might be if you have multiple locations or access to others is really critical, something like a cell phone to be able to communicate with the rest of the team or even the families that the specialists connect with. So that's really what the funding is designed to support, is the HealthySteps specialists, their salaries, fringe benefits, and things that they might need to be successful in their role. And then the training costs, that's already been included. So you don't have to include the training costs in the budget that you submit. So that is being covered by the funding already.
All right. So our question 4, does the licensed behavioral health professional have to take care or have to provide all tiers of services, or could they supervise non-licensed coordinators to take care of lower tier services? This is a great question. Christina, do you mind if I take it and then we can add in?
Please.
So your tier 1 services, those are universal screening. So we want you to screen all children and families 0 to 3 for maternal depression, for social emotional development, for typical development. And we'll talk about what those screeners look like and things like that. So we expect that other members of the staff are going to be part of that workflow, part of handing those screeners out, collecting them, and making sure that we're addressing any concerns that are lifted up from that screening that took place. The HealthySteps program doesn't rely just on the HealthySteps specialist. It really is about programmatic change. So yeah, your front desk staff may be responsible for handing out those screeners, and then somebody, a care coordinator or your HealthySteps specialist may review that with the family to make sure that the needs on that screener that are highlighted are addressed. Christina, would you add anything else to that?
No, I think you did great, Amy. Thank you.
Right. So we have another budget question. Should we only include expenses for which funds are being requested, or a full projected program budget, including in-kind and other external internal funding outside of HealthySteps?
Yes, thank you. And I was trying to look at the budget template and I didn't have it at the ready, so I apologize that we did provide to you. We're most interested in what funds are needed and being requested that we can provide as a part of this funding opportunity. But if you are, for example, able to cover all or a portion of the HealthySteps specialist salary with other types of funds, internal and external funding outside of HealthySteps, that would be really helpful for us to understand that as well.
Great. Thank you, Christina. Number 6, if we apply for only one site, can the Healthy Steps specialist still provide services to other clinic sites virtually?
Well, this is a tricky question, and maybe Amy, you and I can tag team because we're each site that implements Healthy Steps, then we have the model components, the tiers of services that need to be provided for, but also all of the fidelity metrics, so the data piece. So being able to track the data for the sites that are implementing Healthy Steps would be really critical. I'm not sure, Amy, do you have another way to help articulate that?
No, I would agree, and I hope that clarifies it. Really the Healthy Steps specialist is going to be very, very busy. Providing those different tiers of services. And so, yeah, I think thinking about it in that context is really important.
Mm-hmm.
So our question 7 in the list of, that's the question about questions 3 and 7. So we've already gotten that one answered. It looks like in the instructions for, that's another one.
Same.
Yeah, I apologize. How many sites can one organization propose? And does each site require a Healthy Steps specialist?
Yeah, so an organization can propose multiple sites. So we know, for example, of an organization that is interested, they have, say, 9 sites, and they're really eager to look at how they could bring Healthy Steps to all 9 sites for, we like to think of that as practice transformation and continuity across that system, if you will. So that, of course, we encourage you to apply for more than one site if that's possible for you to do so. We have a limited amount of funds, so the number of sites that we can support, whether that's from one organization or multiple organizations, is contingent upon the funding that's required by those sites. So if you have 9 sites but you have some existing staff that can be trained as Healthy Steps specialists, say in over half of those sites, then you'd be looking for maybe partial or full support for the salaries of the other 50% of the Healthy Steps specialists. Then that would be included in your budgets, and we would take that into consideration. And I think that's a really similar second part question. Does each site require a Healthy Steps specialist? So Amy was speaking to that in a couple of questions above. So it really depends on the number of children birthed to age 3. And so we use that capacity guideline that's described to you in the What is Healthy Steps and About Healthy Steps paperwork. And Amy was talking about it with the 2000. Do you want to elaborate a little bit more, Amy, on that again, or just reiterate?
Yeah, I mean, I think 2,000 patients age 0 to 3 is kind of our guideline for that. And that's what history has shown us a Healthy Steps specialist can effectively manage. And so, thinking about that and the size of your clinic, of how many specialists you would need, should be addressed in your funding request.
Mm-hmm. Great, thanks, Amy.
There was the question about, is the Healthy Steps specialist required to have a physical location at every health center at which they will be located? Christine, I'm going to take this one, and if I have misinterpreted it, please chime in. We don't require our Healthy Steps specialists to have a physical office in the space. What we require is they have a space to see clients. So we know that some of our patients coming in are going to have very sensitive issues that they need to address with them, or to link them with appropriate community referrals. But we also don't want to tie up the exam rooms, because we know that patient flow has to continue. So we want them to definitely have a workspace and the ability to see patients privately if needed. Christina, did I answer that? How you read the question?
I believe so, Amy. Thank you. And I want to go back. I think there's one question just before that. And correct me if we did do this, but to clarify, salaries outside of the HealthySteps specialists are not allowed. For example, physician champion time to support buy-in and clinic integration. And we did have a very similar question that we posted to the frequently asked questions, and it was similar. Someone asked, as a project coordinator or a manager, an allowable expense. So in this instance, I think our response would be the same. To reach our goal of funding the onboarding of more than 6 HealthySteps sites in Los Angeles County, we really encourage applicants to assess their existing staffing models and utilize this available funding and resources to support the role of the HealthySteps specialist as needed. We at the national office did not factor in the additional cost of a dedicated project coordinator, manager, or in the question here for the physician champion's time to support buy-in and clinic integration into the overall project budget.
So Christina, it looks like we need to be a little bit clearer about the 2 identical questions on page 7. And I am happy to pull that up if you want to talk a little bit. I can look it up in more detail.
Sure.
I'm sorry, I don't have it memorized.
No, that's okay. I don't either. So we just ask for a little grace and patience. We want to respond to your questions. So bear with us while Amy pulls that up. And I'm going to talk a little bit about the question: can we request funding for 2 HealthySteps specialists for 1 site if the site has more than 4,000 0 to 3 patients? And so yes, because if you're a larger site, then 1 HealthySteps specialist would not be enough in order. They wouldn't have the capacity to serve the number of 0 to 3 patients that your site has. So Amy, I'm just checking in to see if you're ready with that.
I think I am almost ready.
Okay.
Or maybe I'm not. I'm so sorry. I'm having trouble finding the identical questions.
Okay. So I'll just talk for a minute. Are we requesting funds that will last until July when the new Medi-Cal benefit starts, or can we fund the HealthySteps specialist for a longer period of time? So the model for, and as I explained before when we were talking about how we hope to be able to support more than 6 sites, essentially, if we were to onboard exactly 6 sites and all 6 sites needed 1 HealthySteps specialist, the period for each site would be, the funding period, excuse me, for each site would be a period of 2 years. And with regards to the new Medi-Cal benefits, we are closely monitoring that, and part of our HealthySteps National Office, the training and technical assistance that all the HealthySteps sites receive is also around sustainability. And we will have lots of materials and resources available regarding the new benefits as we learn about them and are able to produce those. And what we recently have heard is that while we hoped that that benefit would be available beginning July of 2022, with the release of the January proposed budget from the governor, it appears as though this new dyadic benefit would be available beginning January of 2023. But there are other benefits that have been available or are available, and we will provide support to all sites as needed to be able to understand those benefits and how they can be a benefit or a value add for HealthySteps sites. How are we doing, Amy?
So I think I may need a little more time. I know this seems easy, but I want some time to really look into this.
Sure.
So it's page 7. Amber, that is super helpful, actually.
Page 7 of the, okay, great.
Yeah. And it's number.
I see 2 identical questions on page 7 of the RFP. So,
Yeah.
Okay.
I see it now. It's the statement of why the entity is seeking to implement HealthySteps and the value it can bring, and then the statement of why the entity is seeking to implement. I'm going to try to get into the site interest form because I'm wondering if it's not duplicated on the actual website.
Great, thank you. So that could potentially be an error on our part, and we apologize. So we will make sure it's not, and Amy's gonna check on that. And I see a question that just came in about Welly. And so hopefully you were able to access our I guess it's a almost 2-pager information sheet about what Welly is. Welly is not mandatory. It's accessible by HealthySteps sites, so you're welcome to utilize this tool, which we do, of course, recommend. It's a HIPAA compliant, mobile friendly care coordination and data reporting web-based platform. So it's really a tool that can be utilized by the HealthySteps specialist that could potentially make it easier for the reporting process and also in supporting care coordination. So it has been designed to really align well with the HealthySteps specialist workflow. So it's definitely a tool that can help to support with the data collection and reporting. It has been developed by our HealthySteps National Office in concert. So we did consult HealthySteps specialists when developing this tool, so that we really thought about designing a tool that was responsive to the HealthySteps specialist needs. It can help sites to document all that they need about a family. So we can connect parent and child records through the use of Welly, document well child visits and consults, deploy screenings and track results, receive alerts about missed visits and referral follow-up, and use a closed loop referral capability. So we see it as a streamlined data collection and reporting tool for the HealthySteps program.
Christina, I think I have the answer.
Great.
You only need to address it once. It is in the letter of interest. So you'll do the site interest form, which are all individual questions, and then you will upload your letter of intent to apply. And so when you do that, which we expect it to be 1 to 2 pages, you will only need to tell us the statement of why the entity is seeking to implement HealthySteps and the value it can bring to the entity and individual practices once. Okay, we will look for it once, and once we see it, we are good to go. Is that now clear? Christina?
I think so, but I want to hear from others, particularly those that had the question. Just
Absolutely,
sure.
yeah.
And there is another question, where in the letter of intent should that statement be?
I would say because we have it listed in there twice, as long as it's in there, we'll be able to see it. So whether it's at near the beginning or near the end, it's okay, whatever narrative form it takes, but it does need to be there.
Yes, so as long, Amber, yes, yes.
No, we apologize for that mistake, and we don't want the instructions to be the trip up in this. So yeah.
And no one is a problem child. We appreciate all questions, and our goal is that, you know, it's as clear as possible. And Amy and I know who to ask. If we can ask another team member and we can get a response that's a little bit more clear, we're always happy to do that as well. So
absolutely,
nothing is a problem. We're really excited by this. We think this is such an incredible opportunity. We do have 15 plus sites in California already, plus because we're in the process of onboarding, right, Amy, some new sites to the HealthySteps family in Orange County. So we're really excited about this and would love to see HealthySteps here in Los Angeles County. So for the letter of intent, should we number responses for ease of reading? We leave that up to you for responding. We will carefully review each response, and so if it's helpful as you're writing the letter of intent to document each number, then we appreciate that, but we certainly aren't going to discount any responses for not having the numbers.
So I was just going through, and I think we have answered all of the questions so far, but if I missed one, please highlight it again for me and I will do my best.
I'm going to put my email address into the chat box because at some point we will, you know, end our session here today. And there may have been a question that popped in your mind. We hope as you continue to work on your letters of intent and applications that if you have questions, please reach out to us to ensure that we, you know, address everyone's questions. We also want to make those available to everyone else because someone else might have the same question as you. So we do take those questions and we'll update our, I'll call it our FAQ documents and get them posted on the website. So please feel free to reach out to me directly if anything else pops into your mind after we close our session today.
Christina, we had another question come in just for a confirmation. One organization can request the funding to support multiple health centers, but we have to take into account that there is only funding for a total of 6 HealthySteps specialists for 2 years.
Yeah, and thank you for asking it again, because I think it's so important. Our goal is, more than 6 sites, more than 6 specialists. But if that's the way that we developed the budget, and the allocation was assuming that there would be 6 sites, 6 locations with 6 HealthySteps specialists, and the funding would support their salaries and fringe benefits and other items as we've previously discussed. But it could be possible, as we said earlier, that maybe you're an organization that's requesting, you really want HealthySteps across all 9 of your locations. But you already have some existing staff at some of those locations that can already be trained up as HealthySteps specialists that would work really well with what they're already doing. So you're really looking at funding for the other sites to be able to support HealthySteps specialists. And maybe even at one of those sites, you have some other way of supporting a percentage of their role, and you're really looking to request funding to support 1/2 full-time equivalent of their role. And so we really encourage you to look at what your needs are and to put forward an ask that best represents that.
Great job, Christina. Another question: is a HealthySteps specialist required to be a licensed behavioral health provider, as opposed to a health educator, for instance, because they are billable or based on the work they will do?
Such a great question. And so, no, they're not required to be a licensed behavioral health provider. With the new benefits that are currently available and will be available through Medi-Cal, like, for example, the new dyadic benefit, or the existing family therapy benefit. For the existing one, in order to take advantage of that particular benefit, then if it's the HealthySteps specialist and they're providing that service, in order to be able to bill for that and to be reimbursed for that service, they would need to be licensed. But we do have HealthySteps sites both in California and other places that are using other professionals to serve as the HealthySteps specialist. And we just want to ensure, sustainability beyond the funding that we're able to provide. So one of the pathways that we know now is with the existing benefit and the new dyadic benefit, which we assume will also require a licensed behavioral health provider in order to take advantage of those billable opportunities or reimbursable opportunities. So, but we do not require that. It's recommended, but if you have another sustainable pathway that you can speak to in the application, we encourage that. And we also know there are other benefits in the works within Medi-Cal as well. And so as we continue to learn and be engaged in those, then how they relate or can benefit HealthySteps and the role of the HealthySteps specialist, then we share that across the network. I hope that answers that question.
But again, please clarify it or ask another question if it. But I think that was,
thank you, Gina.
Very thorough. I don't see any other chats coming in. Give it just a couple minutes.
Maybe if it's not too much trouble, Amy, would you mind putting the funding website in one more time, just for ease of access? I know the chat moves up. I see my email address still in there. Want to be sure that folks have access to us, have access to all the documents. Oh, and I believe I mentioned the PDFs that are available that hopefully really help you with your application. So we know once you log into the system that when you're filling out the site interest form, for example, and ready to submit your letter of intent, you weren't really able to advance to see questions ahead of time without completing the fields in there. So we, once again, just want to remind you that that is a review only PDF on our website, and the full application is available up there as well. The questions and responses as of last week, and we'll be posting the questions and responses that we received today. There is the exploration guide, as well as the sample budget is included in the exploration guide, available as a PDF. The fidelity overview requirements. So hopefully, and the WELI one-pager. So more information available to describe what WELI is and how that, you know, could potentially benefit HealthySteps sites. So just want to make sure, thank you, Amy, for posting the website. All of those are listed and available up there.
And we haven't had any other questions coming in. You know, we've got about 2 minutes left, but I know that we started a little bit late, so I want to make sure that everybody got their questions in, and that it is clear as possible. Again, I am Christina, and I will work to type all of these answers up and post it on the website for your review. The previous questions are already up there. There's some great documents to help you submit hopefully a successful application.
Mm-hmm. Oh, let's see. The practice assessment is embedded in the full application questions. How do we differentiate for other non-practice assessment questions? And so they're all within the application. I would say if you look at the full application form for review only on the website, that's exactly what you'll see once you log into the application to be able to submit all of your responses. So you won't have to really differentiate the non-practice assessment questions. Our system will do that automatically and actually create a practice assessment form that all new sites are required to complete.
Correct.
Mm-hmm.
Where is the resource link posted?
In the resource to the website, and all of the resources is in the chat box. And I can post it. In there as well. So hopefully that's the resource that you're looking for. Please let us know. All of the resources are on the funding website. Okay, great. Wonderful. And my email in the chat box. So you do have to click that open if you just had the Q&A open. So make sure you look at the chat. You can have my email address, and we've reposted the website link with all the resources there. I don't see anything else. So we don't want to end too soon. We'll stay on so for another couple minutes. But if you have all of your questions, you feel like they're all addressed at this moment in time, I will say, then we just want to say thank you so much for joining us. Thank you for your patience. Apologies once again for joining late and for having my calendar reminder on the screen. I'm so sorry. So thank you for flagging that for us. And once again, Amy and I are just so excited, and the entire rest of the national office team, about this incredible opportunity to bring HealthySteps to Los Angeles. We hope that all of you apply and that we can just really support as many sites as absolutely possible with this opportunity. So please feel free to send us any additional questions that you have. And otherwise, we wish you a wonderful rest of your Wednesday afternoon.
Absolutely. Be well, everyone. Look forward to reading your application.
Mm-hmm. Great. Thank you, Celia. Wonderful. Okay. I think, Amy, I'll check one more time, but I'll go ahead and end our session, and I'll see you soon.
Okay. Thanks, Christina. Bye, everyone.
Bye, everyone.